Good morning. This is Aslam Khan, Professor of Medical Surgical Nursing from Index Nursing College. Today we are dealing and discussing about the neurological disorder that is Myasthenia Gravis. So what is Myasthenia Gravis? Myasthenia Gravis is an autoimmune disease of the neuromuscular junction characterized by the fluctuating weakness of certain skeletal muscle group. So, as I said, myasthenia gravis is an autoimmune disease of the neuromuscular junction. So, if we'll talk about the incidence of myasthenia gravis is more common in women, but at older age, both sexes are equally affected. Myasthenia gravis is considered infrequent over the age group of 70 years. Okay, is it clear? Okay. Next, if we see the causes and pathophysiology of myasthenia gravis. So, myasthenia gravis is caused by an autoimmune process in which antibodies attack acetylcholine receptors, resulting in a decreased number of acetylcholine receptor sites at the neuromuscular junction. This prevents acetylcholine molecules from attaching and stimulating muscle contraction. Anti-acetylcholine receptor antibodies are detectable in the serum of 85 to 90% of patients with generalized myasthenia gravis. AChR may be related to auto-antibodies to the muscles specific receptor tyrokinase. In many cases, thymic tumors are found in nearly 15% of patients who is having myasthenia gravis. And in many cases, abnormal thymus tissue is found in the most of other cases. So, what is autoimmune? Autoimmune disease where human being own immune system antibodies destruct our cells or destructs our organ, might be due to the entry of any foreign bodies or during infections time. In many diseases, our own body cannot recognize foreign substance or infection, and there is initiation of self-destructions by our own antibodies towards any specific organ or tissues or neuromuscular junction. This is a classical example of autoimmune disease, that is myasthenia gravis. Next, we will see the clinical manifestation and complication of myasthenia gravis. In the beginning, the primary features of myasthenia gravis is fluctuating weakness of skeletal muscles. Muscles most involved are used for moving the eyes and eyelids, chewing muscles, swallowing, speaking and breathing. These are the mainly target muscles which involve initially in the case of myasthenia gravis. It also involves muscles of the trunk and limbs are less often affected in these cases. In the myasthenia gravis, there is no sensory loss. Usually reflexes are normal and muscle atrophy is rare. So we can say myasthenia gravis is a disease of mainly skeletal muscles. Even in these cases, if person take rest, there is recovery of the muscles, and again after rest person gets rest. After rest person get some kind of restoration of health as well as energy level also. Next, if we talk about the complications, there are several complications which is related to the Myasthenia gravis. This includes many muscles progressively involved, usually lower part of the muscles are less involved. In this, there is difficulty in chewing and swallowing foods. Speech is also affected, and the voice often fades after a long conversation. So, I said earlier, the muscles of the trunk and limbs are less often affected. In the proximal muscles of the neck, shoulder, and hip are more affected than the distal muscles. In myasthenia gravis, there is no other sign of any neural disorder. There is no any sensory loss. Reflexes are normal, and muscle atrophy is very rare in these cases. In many times, the patient recovers without any proper treatment, and in many cases, the condition become more vigorous and deteriorated. Many times, exacerbation of myasthenia gravis can be precipitated by emotional stress, pregnancy, menses, secondary illness, trauma, and temperature of extremities, and in the case of hypokalemia. There are various drugs which stimulate myasthenia gravis, including aminoglycoside antibiotics, beta-adrenergic blockers, procainamide, phenytoin. These drugs also aggravate the clinical manifestation of myasthenia gravis. So, there is sudden exacerbation of myasthenia gravis in severe cases known as myasthenic crisis, which is an acute exacerbation of muscles weakness triggered by infection, any surgery, emotional distress, and due to drugs overdose or inadequate drugs. For a prolonged, the person who is on prolonged medications is not taking, there is any drug withdrawal. The major complication of myasthenia gravis result from muscle weakness in areas that affect swallowing and breathing. The result in aspiration, respiratory insufficiency, and respiratory infections. Next, we talk about the diagnostic studies, diagnostic evaluation for myasthenia gravis. Mainly, these are the history, physical examination, electromyograph, and tensilon test. So, in history, we will ask the patient about any exposure of any disease, infection in past, like any respiratory illness, any surgery they have done, or there is severe exacerbation of any other disease. In physical examination, we will found the patient's muscle tone, will check it, patient neurological response. When we will go for EMG, which shows a decrementing response to repeated stimulation of the hand muscles, indication of muscles fatigue. Many drugs also aid in the diagnosis of myasthenia gravis, which include tensilon tests, in which the patient with myasthenia gravis reveals improved muscle contractility after intravenous injection of the anticholinergic agent, that is atrophonium chloride. This test is also aids in the diagnosis of cholinergic crisis. Okay. So this is the diagnostic studies for myasthenia gravis. Next, we'll see the management. The management include drug therapy. The drug therapy for myasthenia gravis include anticholinergic drugs, alternate corticosteroid therapy, and immunosuppressive therapy. So, anticholinergic drugs are aimed at enhancing function of the neuromuscular junctions, Acetylcholinesterase is the enzyme that breaks down acetylcholine. This inhibit the enzyme by the anticholinesterase inhibitor will prolong the action of SEH and facilitate transmission of impulses at the neuromuscular junction. Apart from this, neostigmine and pyridostigmine are our most successful drugs to treat myasthenia gravis. So, corticosteroid therapy, especially prednisolone, are used for suppress the immune response. Drugs such as azathioprine and cyclophosphamide are also used for immunosuppression. So, when patient is not getting relief from drug therapy, will go for surgical therapy. As we know, because the presence of the thymus gland in the patient with myasthenia gravis appears to enhance the production of SEHR antibodies. So, removal of the thymus gland result in improvement in the majority of patients. So, thymectomy is indicated for almost all patients with thymoma. For patients with generalized myasthenia gravis between the ages of puberty and about the age of 65 years. Apart from this, for other therapies, plasmapheresis can somewhat improve the clinical manifestation. This mainly plasmapheresis we use the patient who is having myasthenia crisis or patient who is going for any surgery. IV IgG is also used as a second line treatment for myasthenia gravis. So apart from this, nursing management is also very important part. History taking and give proper guidance and counseling of the patients, and patient is here dependent on others. So nursing care is very important here to reduce the patient stress, anxiety, and to cope up the patient physical conditions. Thank you so much. Nursing management and nursing assessment of myasthenia gravis is very important because the nurse can assess the severity of myasthenia gravis by asking the patient about fatigability, what body parts are affected and how severely they are affected. The patient coping abilities and understanding of the disorder should also be assessed. The objective data from the nursing side should include respiratory rate and depth, oxygen saturation, arterial blood gas analysis, pulmonary function test, and evidence of respiratory distress in patient with acute myasthenia crisis. Muscle strength of all face and limb muscles should be assessed and should be swallowing, speech, volume and clarity, and cough and gag reflexes. So this all data has to be assessed by nursing person, nursing staff, and proper expected out goal and proper intervention and implementation should be done by the nursing staff. As we know, the person with myasthenia gravis is very anxious in very stressful conditions, and person is totally depend for care. है ना? So the nursing diagnosis we can make for myasthenia gravis include: first one is ineffective breathing pattern related to the intercostal muscle weakness. Second nursing diagnosis is ineffective airway clearance related to intercostal muscle weakness and impaired cough and gag reflex. Impaired verbal communication related to weakness of the larynx, lips, mouth, pharynx and jaw. Imbalanced nutrition, less than body requirement related to impaired swallowing. Next nursing diagnosis is disturbed sensory perception, visual related to ptosis, decreased eye movement and disconjugate gaze. Next one is activity intolerance related to muscle weakness and fatigability. Disturbed body image related to inability to maintain usual lifestyle and role responsibilities. If we will go for planning for care for myasthenia gravis, the overall goals are of the patient with myasthenia gravis will have a return of normal muscle endurance, to manage fatigue, avoid complications, and maintain a quality of life appropriate to disease course. So nursing implementation is also very important. The patient with myasthenia gravis who is admitted in the hospital usually has a respiratory tract infection or is an acute myasthenic crisis. Nursing care is aimed at maintaining adequate ventilation, continuous drug therapy, and watching for side effects of therapy. The nurse must be able to distinguish cholangitic from myasthenia gravis because the causes and treatment of the two conditions differ greatly. As with other chronic illness, care focuses on the neurological deficit and their impact on daily living. A balanced diet with food that can be chewed and swallowed easily should be prescribed. Semi-solid foods may be easier to eat than solids or liquid. Scheduling doses of drug so that peak action is reached at mealtime may make eating less difficult. Diversional activities that require little physical efforts and match the interest of the patient should be arranged. Teaching should focus on the importance of the following the medical regimen, potential adverse reactions to specific drugs, planning activities of daily living to avoid fatigue, the availability of community resources and the complication of the disease and therapy. Crisis condition should be analysis. Prior strategy is very important in the case of myasthenia gravis. So if we evaluate the proper care of the myasthenia gravis, the overall expected outcomes are the patient with myasthenia gravis will be maintain optimal muscle function, be free from side effect of drugs, not experience complication in particular myasthenic or cholangitic crisis from the disease, maintain a quality of life appropriate to the disease courses. So we conclude the topic of myasthenia gravis. As I said, myasthenia gravis is autoimmune disease of the neuromuscular junction, which is characterized by the fluctuating weakness of the certain skeletal muscle group. So skeletal muscle group are the voluntary muscles group. So as I said, it's autoimmune disease of the neuromuscular junction. So here, what is the meaning of autoimmune? In this case, autoimmune disease where person own immune system or antibodies attack our organ cells or tissue and it start destruction of that tissues or cells. There are some precipitative factors, or we can say risk factor or aggravating factors like stress, infections like a respiratory infection, hyperactivity, person who is having any thymus gland disorders. These are the few conditions where there is more exacerbation of myasthenia gravis. Clinical manifestation are, as I said, this myasthenia gravis mainly catches and affect skeletal muscles. That also mainly upper body skeletal muscles. It affect in the primary cases, and the muscle most common which is used for moving the eyes and eyelids, chewing, swallowing, speaking, and breathing. So this muscles group are mainly affected by these conditions. So person here gets tired very easily, very fast, and person takes rest. Again person feel after a few minutes or hours, person gets feel fresh and energetic. Here mainly the antibodies attack neuromuscular junctions, and it doesn't allow acetylcholine to influx in the neuromuscular junction. It acts as an obstacle. So in neurons, acetylcholine won't influx properly. So there is no any muscles properly contract, and the person feel no power, restlessness person feels. So myasthenia gravis is an acute exacerbation of muscle weakness triggered by infection, any surgery, emotional distress, drug overdose, or inadequate drugs. The major complication of myasthenia gravis result from muscle weakness in area that affects swallowing and breathing. This result in aspiration and respiratory insufficiency and respiratory infections. Diagnostic studies include history, physical examination, electromyograph, and tensilon test. So in history, we'll ask the patient about any history of any previous surgery, infections, or any trauma. In physical examination, we will check the patient reflexes, muscle tone, patient's posture, patient gesture, and in tensilon test, we'll do it in which we'll give intravenous injection of anticholinergic agent, that is hydrofonium chloride. This anticholinergic block the enzyme acetylcholinesterase. So after giving this intravenous injection of hydrofonium chloride, if patient get recovery and patient gets recover and patient feels energy within a minutes, it means there is positive tensilon test, person is having myasthenia gravis. So the drugs used are anticholinergic agents. Alternative day will start corticosteroid therapy, will give immunosuppressive agents, and last we'll go for surgery, that is thymectomy, and we'll go for plasmapheresis. Thus, this management resulted in relief of myasthenia gravis symptoms. Thank you so much.